Last night, the Premiers and I held our 10th weekly call since the beginning of the crisis. And we talked about what's been on everyone's mind lately, how we can safely reopen the economy. Over the past few months, Canadians have been doing a great job of staying at home, maintaining physical distancing, and listening to public health advice. And that means we can restart some activities, but we're not out of the woods yet. COVID-19 remains a serious health threat. We have to proceed with caution and keep listening to science, or we risk losing the progress we've made. So today, I want to outline what we know needs to happen to successfully reopen the economy and adjust to our new normal. First, we need to continue scaling up our testing capacity so we can quickly identify new cases and isolate them. We're working with provinces and territories to expand testing by procuring things like reagents and swabs. While some provinces have the capacity to meet their current needs, we're collaborating to ramp up testing so we can protect Canadians and effectively manage future outbreaks. Second, we need to accelerate our ability to do contact tracing. After we've confirmed and isolated new cases, we have to get in touch with everyone who may have been exposed to the virus and make sure they take measures to quarantine and monitor themselves for symptoms or get tested. While provinces and territories are managing testing and contact tracing differently, our government has trained federal employees who can make 3,600 contact tracing calls a day, 7 days a week. Statistics Canada has also an additional 1,700 interviewers ready to go who can make up to 20,000 calls a day. These federal resources are available to assist provinces and territories with any surges or backlogs or challenges they have in contact tracing. We're already helping to make calls in Ontario and stand ready to help anywhere else. Third, we have to ensure that data collected across jurisdictions is shared between provinces and territories. This will help us track the spread of the virus, adapt our response accordingly, and save lives. Canada is a vast country, and some regions have been hit harder than others by the pandemic. That's why plans to relax restrictions vary from one jurisdiction to another. But in order for people to move around freely and start getting back to normal life, we have to improve our ability to quickly pinpoint the virus and isolate it. All premiers recognize how important this is, and I want to thank them for their engagement in this issue. Since the beginning of this crisis, all jurisdictions have been working towards one common goal: protecting Canadians. The next phase of our collaborative efforts is on testing, contact tracing, and data collection. And I've told the premiers that the federal government is here to support, facilitate, and fund this important work. Taking strong, collaborative action to expand testing and contact tracing is important for both Canadians and businesses to have confidence that we're on the right foot. They need to know that we have a coordinated approach to gradually reopen that is rooted in science, evidence, and the ability to rapidly detect and control any future outbreaks.
Let's talk about the testing, and specifically, we'll start with you, Mike. What is the government doing, the federal government doing, to help provinces who need more testing?
Yeah, essentially the Prime Minister has said, look, the help is on the table. It's just a matter of whether or not provinces want it. And noting that, especially with contact tracing, he said that they have trained up people that can make up to 3,600 calls per day in 24 hours a day, 7 days a week. And then talking about how Statistics Canada has also trained up upwards of 1,700 people that could make about 20,000 calls per day. So those people are on standby on the contact tracing. When you're talking about the testing, the Prime Minister also said that was talked about yesterday with the premiers in that call, that weekly call, the 10th one he mentions that they've had, and saying that, look, if they need the swabs, if they need the reagents, that the government is there to help them procure them and help them get them, noting that, yes, they are well under the threshold of the 60,000 tests per day that this government has set out that it could do, and saying that, look, one of the issues is that in some provinces, they don't need to do it because they seemingly have the virus under control. interesting to note, though, that he did encourage people, even if they are asymptomatic, to go ahead and get a test. So when he said that, I fired off a quick text to a source in the government and asked, well, has this Prime Minister gotten a test? Because you'll remember he said he wasn't going to get tested because he was following public health advice and making sure that if only he presented symptoms would he get a test. The answer back, the Prime Minister has not had a test himself. So it's interesting that he's recommending to Canadians who are asymptomatic to go ahead and get a test. But according to a government source, he himself has not gotten tested. Wondering if that will change now, if he will practice what he's preaching instead of just telling everybody else to get a test and him not getting one. The excuse in the past has been he didn't want to waste a test on himself, that he feels good, and that he has not been presenting symptoms. But you have to wonder whether or not that could change, because he is recommending people, symptomatic or not, go ahead and get a test. Farah?
I am really glad you mentioned that asymptomatic part, because that really stuck out to me as well, especially when we look across Canada. I believe that Saskatchewan is the only province that starting Monday is a place where you can get tests if you are asymptomatic. Everywhere else, I believe you have to have symptoms to get a test. So will that change given what the Prime Minister said today?
Well, it's interesting because we've also heard Premier Doug Ford here in Ontario talk about, look, let's do random testing. Let's go out and get, Uber drivers, limo drivers, people who are working in food facilities, test all of those people. If we have the tests, why not use them? At his frustration that his own province has not been ramping up the testing to the level that he would like to see. So you have to wonder whether or not out of that call last night, there will be more of a push to test more people. Or does that sort of, because it's interesting here, it's, the politicians were calling for more tests, and then you have the public health officials who are saying, in some cases, something different, saying that, look, maybe the serological test. Yesterday, Dr. Theresa Tam, Canada's chief medical officer, saying that the serological test really needs to be sort of ramped up as well, because there's a potential iceberg sitting there of people who have the disease and who are maybe asymptomatic and haven't presented yet and may be transmitting, and that would be helpful in guarding against that second wave. So it will be interesting now, following that call last night, whether or not different provinces and different premiers will change their tune as to whether or not they think that people who are asymptomatic should be tested, as the Prime Minister just noted today.
I should mention as well, Calgary did testing for asymptomatic Canadians as a city, but not as a province. I'm going to bring in Keith Baldrey, Mike, and I'll keep you there as well. And Keith, what's really interesting about this is the opinion on mass testing, random testing. It really varies from province to province. Where does your provincial health officer, Bonnie Henry, sit on that?
It certainly does vary from province to province. And Dr. Bonnie Henry here, she's been asked many times about her testing strategy, and she has a unique strategy. She does not buy into the theory that we have to do this mass testing, random testing. She thinks it's a waste of time, a waste of resources. She says basically she wants to test where do they think the virus is and track it through the community, and that does not mean random testing. At the beginning of the pandemic, British Columbia tested travelers, people coming from other countries who were thought to be bringing the virus into BC. Then the shift was to frontline healthcare workers who were logically thought to be the ones most likely in contact with people with the virus. Then it was more in the community. And now the current strategy is if you have symptoms, you can get a test. But the number of tests in British Columbia really is not that much, about 1,500 a day right now. We were peaking about 3,500 at the beginning or the midpoint of the pandemic. And just to put this in context, on Vancouver Island, where I am, where the capital is, there's about 800,000 people. There's been about 2,000 tests done in the last 10 days. 0 cases have showed up. So that shows that testing can only take you so far. The other aspect that Dr. Bonnie Henry has talked about is the very high level of false negatives or even false positives that come from this COVID-19 test. And she thinks that the data that comes from those testings is flawed in some ways because of so many inaccurate tests that come back. She doesn't want to rely on testing totally in terms of devising a strategy to fight this virus. She thinks other other things have to be prevalent. And that is the number one thing, of course, is physical distancing. That's the number one measure employed in British Columbia and other jurisdictions to keep this virus under control, is keeping that physical distance from other people. So the emphasis on testing, I think, may be more significant in places like Ontario and Quebec, where the outbreak of the virus is so much more severe than in other provinces. And you heard the Prime Minister talk about how some provinces really aren't impacted by this because they have the virus under control, and I think that includes British Columbia.